Focused on the question number 352. A 40-year-old woman presented with a bony hard mass along the midline of the hard palate. Diagnose the condition. Is it fibroma? Is it lipoma? Is it torus palatinus? None of the above. So it's a bony hard mass that is along the midline of the hard palate. So a very easy MCQ. It is the torus palatinus. It is the torus palatinus. Our next question. Well-defined concavity in the lingual surface of the mandible with the salivary gland origin is seen in the lingual surface of mandible. Identify the condition. Though the picture is not clear, there is a key term, that is it's originated from salivary gland, and the location is below the mandibular canal. You can see the arrow at the left of the mandible. Now the options: traumatic bone cyst, periapical cyst, globulomaxillary cyst, static bone defect. Answer is static bone defect. Static bone defect. Now the explanation of that question. The classic defect of Staphine bone cyst, oblique lingual mandibular salivary gland depression, oblique latent bone cyst, oblique static bone defect, they are all same thing in different nomenclature. Presents as an asymptomatic radiolucency below the mandibular canal in the posterior mandible between the molar teeth and angle of the mandible. Staphine defects typically remain stable in size, hence the name static bone cyst. So this is the explanation of the last question. So the next question, 354. Lesion with diffuse grey white milky opalescent appearance of mucosa that disappears when stretched is seen on buccal mucosa. Diagnose the lesion. So the key word or key term is that disappears when stretched is seen on buccal mucosa. So the options are linea alba, leukodema, leukoplakia, lichen planus. It's a very easy question. Correct option is B, leukodema. Now we'll go to the discussion part. Focus at the 354 number. Leukodema is characterized by a diffuse grey-white milky opalescent appearance of the mucosa. Leukodema typically occurs bilaterally on the buccal mucosa and may extend forward onto the labial mucosa. They disappear when stretched and thus helps to distinguish it from conditions like leukoplakia, lichen planus and candidiasis. Now the next question, focus on 355. A 40-year-old male presented with bony hard nodules along the facial aspect of maxillary molar. Identify the lesion. So once again I am reading. A 40-year-old male presented with bony hard nodule along the facial aspect of maxillary molar. 40-year male, and that nodule is bony hard. You can see the option: gingival hyperplasia. Hyperplasia can't be bony hard. Abscess, periodontal abscess can't be. Exostosis, aphthous ulcer. Aphthous ulcers can't be bony hard type lesion. So it must be C, exostosis. So C is the answer, yes. So you don't need any explanation, I think. Next question. A 60-year-old man presented with grayish discoloration of the face. Which metal intoxication can cause this condition? Is it lead, mercury, copper, silver? Grayish discoloration, that is the only term, useful term. So the answer is silver. Silver is the answer. So now the next question, 357. Identify the following. You can see the condition here. Redness around the lips, some whitish discoloration also is there. I think that are nodule kind of thing. No, options are cheilitis glandularis, cheilitis granulomatosa, actinic cheilitis, angular cheilitis. So in my opinion it must be cheilitis granulomatosa. 157, yes, this is the answer, cheilitis granulomatosa. Now we'll see the explanation. Now the explanation is, it is a chronic swelling of the lip due to granulomatous inflammation involving either one or both the lips, upper lips greater than lower lips. Lip appears cracked with reddish brown discoloration and scaling. It is also termed as mixture cheilitis when confined to lip. Wilkerson-Rosenthal syndrome term is used when cheilitis occurs with facial palsy and ligated tongue. So that's kind of cheilitis with facial palsy and ligated tongue, that is Wilkerson-Rosenthal syndrome. Now we will go back to the question. That is 358 number question. Identify the following conditions. Look at the 1-1 region. Is it fusion? Is it gemination? Is it concrescence or then invaginatus? The answer here, it is gemination. For explanation, please go back to your oral pathology book. Next, a newborn infant was clinically presented with multiple yellow-white mucosal papules as shown. What could be the diagnosis? So in this picture you can see at the maxillary alveolar region, buccal region actually, there are mucosal papules. Their color is yellow-white. So what are that? Is it Epstein pearl, eruption cyst, Vaughan's nodule, epidermoid cyst? What is the answer? It is the Vaughan's nodules. I'll go back to the explanation. Number question. Yes, Vaughan's nodules arises from epithelial remnants of the deeply budding dental lamina during tooth development after the 4th month in utero and were scattered more widely over the hard and soft palate. A similar cyst of the palate in the newborn arises from epithelial remnants remaining in the stroma after fusion of the palatal process, which meet medially to form the palate and are found along the median raphe of the palate. So these are Vaughan's nodules. These are epithelial remnants of the deeply budding dental lamina during tooth development after the 4th month of in utero and were scattered more widely over the hard and soft palates. But it is not on the palate, it is on the alveolar. Okay, so next question. It seems easy to me. Let's see. Identify the order. I don't need to read out the options. The first one is, you can see, it is geographical tongue. Second is hairy tongue, and last one is fissured tongue. The option B actually, geographic tongue is also called migratory glossitis. It is hairy tongue. Next is scrotal or fissured tongue. So the answer is B. Now next question. You can see what are these abnormality or structures. These are nothing but talon cusp. 361, yes, talon cusp. So this, you can see, is the talon cusp. Now the next question. Identify the sign and the symptom. Hyperextensibility of the finger. It must be Ehlers-Danlos syndrome. (164) is option D, Steinberg sign, and it's a Marfan syndrome. So I'm wrong. Correct answer is D, that is Steinberg sign and Marfan syndrome. So this much for today.
we'll post next video with other questions. We'll continue the series, picture based series. Thank you very much for patience listening.